Welcome to today's DPI update, today being 18 December 2020. Of course, we have, as always, Minister of Health, Honorable Dr. Frank Anthony. Minister, welcome again to the program.
Well, thank you very much.
And I want to start off, it's literally 1 week, 7 days before Christmas. And I know you have spoken extensively on the whole question of the holidays and safeguards that people should be paying attention to. But I would like to give you the opportunity just to repeat your message of goodwill to the people of Guyana, having full regard, of course, to the current pandemic which the world is facing, but of course we here in Guyana as well.
Well, thank you very much. I just want to wish everyone a joyous holiday season and a safe one, because we are into the pandemic and we all need to take precautions. We need to keep our distance. We need to wear masks and sanitize. And if we take these simple measures, we're certainly going to remain safe for the holidays. So I just want to wish everyone, as we celebrate the season, to also think about safety of ourselves, our family, and our friends.
Have you recalled in your experience as a medical professional and as a former government minister, any time more challenging in Guyana than what we're facing right now?
This is an extremely challenging time because it's the first time that we are experiencing a pandemic of this nature. And therefore, this disease can spread quite easily. And if we don't take precautions, unfortunately, a lot more people would get sick. And while from the profile of the disease, we know that about 80% of the persons who get sick would probably be mildly symptomatic or don't display any symptoms at all. There's that 20% who would require hospitalization, of which 4 would require ICU care. And unfortunately, because we don't have a specific medication to treat with the coronavirus, some of those persons would die. And that's why it's important that we get people to understand that they have to take precautions and remain safe. There is optimism on the horizon because, as you know, there are a number of vaccines that are now available. One vaccine has already been given emergency use authorization, and that has now been used in the UK, the United States, and Canada to start immunizing people. And the expectations are that this same vaccine would also get emergency use authorization in Europe. As of the 21st of December, the Moderna vaccine is up for review by the FDA, and they too, it is expected that they would also receive emergency use authorization.
You actually preempted that question, Minister. Just to ask further to what you just explained, what is the significance of having an additional vaccine available for global use?
Well, you know, we need to have as much vaccines as possible, but vaccines that are also very efficacious. And the 2 vaccines that have been talked about a lot, which are both mRNA vaccines, and that is the Pfizer vaccine and the Moderna vaccine. These vaccines are going to make a big difference in terms of managing the pandemic. Already we see millions of people have already received the Pfizer vaccine. The challenge with Pfizer's vaccine is that you have to store it at extremely cold temperatures, and that can be a little bit challenging because you require what is called an ultra cold chain, meaning that vaccines must be stored at minus 70 degrees Celsius. The Moderna vaccine is slightly different. It does not require the minus 70, but you can store at minus 20. And some countries in their cold chain already have minus 20 freezers, so that's a plus. But if you're going to use the Pfizer vaccine, then you have to buy the minus 70 freezers. So with both vaccines becoming available, it would certainly change the dynamics of the pandemic. Um, and I guess people are looking forward to receiving their vaccines because certainly this is going to protect you.
I know persons can research and maybe Google, but what do you mean by efficacious in terms of the use of vaccines, medically speaking?
Well, it's safe. That's, you know, when you do a vaccine, it goes through different stages. So the first stage is called preclinicals because it's really testing this on animals to see whether what you what you want to use as a vaccine, if it's going to work. And once it passes that test on animal models, then you start doing a phase 1, phase 2, phase 3 trials. In some cases, people have combined phase 1 and phase 2, which is checking for safety and dosage requirement. And then in a phase 3 trial, you do that with a lot more people just to ensure that it's working properly and you look out for adverse events. And so these two vaccines that are up for emergency use authorization would have gone through that process. And the authorities, the FDA in the US, in the UK, in Canada, and in Europe would have deemed it to be, to met all the requirements, and therefore they've authorized its use.
Just staying a few more seconds on Moderna vaccine. Any particular significance for Guyana in the context of access to vaccines in the coming months?
Well, yes, because as you know, we have been working through a global mechanism called COVAX. And COVAX has listed as part of its portfolio of vaccines the Moderna vaccine. So yes, because once Moderna is part of that COVAX facility, the likelihood that we can get such vaccines.
Let's stay on the international scene for a few more minutes. In relation to a World Health Organization team planning to travel to Wuhan, China, where it is believed the virus originated, but I'm not going to ask you for your personal views on where it originated, but how significant it is, how important is it for medical professionals and the experts, researchers, to know where a virus originated and how it developed?
Yeah, well, the WHO going to China, it has its genesis from discussions early in the year where people wanted to know more about how this virus start infecting human beings. And there were lots of discussions at the top level of the WHO, and a decision was made at the level of the executive board of the WHO and also at the World Health Assembly that they would send an investigation team to China to work with the Chinese authority in trying to determine the source of the virus. And this is normal practice because you want to get more information. We know that over the last 20 years or so, there have been a number of viruses that would have started with animals and then leap over to human population. You had the case of SARS, and with SARS that came over to human population from animals. You had MERS, which is the more recent one, that is the Middle Eastern respiratory syndrome. And so that too came from animals, camels in this instance. So we have had cases as human population get closer to the habitats of these animals, that there's a possibility that viruses that animals would normally have can jump from one species to another. And when that happens, for human beings, it's novel to us. Our immune system has never encountered these viruses, and therefore it can spread quite rapidly in human population. And that's the theory behind what has happened here with COVID-19. Because human beings did not have immunity against the SARS-CoV-2, you had this rapid spread in our population. But the WHO, nevertheless, would like to, get to do an investigation to determine the origin of the virus, and I guess we'll see what those findings would be.
Let's come closer to home now, and you have spoken previously about some mining or some tests done in additional testing done in some mining communities. I know Region 1 was targeted, Region 7, Region 8 and 10 combined. What about the spikes that you've briefly alluded to previously this week, and the role of health officials now in those communities as regards preventing further spread?
Well, I mean, I think we have a fairly robust surveillance systems across the region. And using the regional teams, they're able to detect cases across the country. So we will continue to work with them and get them out to various communities that we feel might be more at risk. And once we do that, we'll get a sense of whether they're positive cases or not. Using that information, then we'll determine what other strategies we need to use in those communities. And that's what we've been doing over the last couple of months. So as we test more and as we go into specific areas, we can find whether they're positives or and that's what we've been using.
People hear the term contact tracing all the time when positive cases are identified. Let's use one example to simplify it so that persons can understand what is involved in contact tracing. And I'll give you the liberty of choosing your example.
So when somebody tests positive, so they come into one of our testing sites and we test them and they're positive, what we want to determine is all the persons who they would have been in contact with. So we will interview them to get a sense of who have been close to you, who is at home with you, have you been working, who are your workmates, how do you travel from home to work, do you, from work, do you go into the community, so what we are trying to do is to establish how many persons this infected person might have been in contact with and for how long. And whether or not during this period, whether they were using their mask or not using their mask and things like that, because all of that can have an impact on transmission. So once we establish all the contacts that would have come in proximity to this person, then we are able to reach out to those persons, talk to them, ask them to quarantine themselves, to observe themselves for the next 5 days or so, just to ensure that they don't have any signs and symptoms, and to offer them to do a test for them, so a PCR test or an antigen test, to see whether or not they're positive. And if they're positive, well, then we have to isolate them. So contact tracing is really geared to see how many other persons this person might have infected, and to let those persons know so that they don't unwittingly infect others. So it's a way of checking on the epidemic and trying to contain it.
So a whole lot depends then on the honesty and the full disclosure of that person who tests positive.
Yeah, exactly. Because if people withhold information from us, then it's difficult for us to do such contact tracing.
Okay, Minister, in closing, I want to ask you one final question, because only yesterday a number of nurses graduated, and I presume they will now enter the healthcare system in Guyana. Your message to those nurses who successfully passed their exams, and perhaps generally nurses in Guyana?
Well, I want to congratulate all the nurses who would have written their exams and passed, and we welcome them into the public health system. As you know, we are always looking out for good workers, and I'm sure that given the training that they've had over the last several months and years, that they will do extremely well in the health system. They're coming into the system at a very important time, a time when we have a pandemic, and while it's challenging, there's so much that can be learned during this time. So I want to wish them well, and I want to encourage them to use all the opportunities they have to constantly improve their knowledge so that they can serve their patients to the best. Nursing, as with medicine, is a very compassionate profession, and we are here to serve the public. We are here to serve people, and we actually see people when they are the most vulnerable, and they require our empathy and compassion. And if we can continue to serve in that way, then we will do our jobs, in the best way possible. So I wish them well, and I want to welcome them all to the profession.
Thank you very much, Minister. And for those of you who have been watching on TV or listening on radio, thank you for joining the Minister of Health, Dr. Frank Anthony, on today's DPI Update. I'm Daniel Singh saying goodbye for now on behalf of the DPI Update team.